Hello, my name is Dr. Christy Westfall, and I'm the program coordinator for the Pediatric APRN program at the UCLA School of Nursing. Many of you may be contemplating next steps in your nursing career trajectory, as well as what patient population you'd like to focus on. So let's get down to it. Why pick peds at UCLA? I'm here to help you navigate. So why peds? If you are passionate about caring for children, you definitely should pick peds. No other specialty will give you the comprehensive, child-focused preparation that will set you up to succeed for an APRN career focused on child health care. So, why UCLA? I'm going to let you all in on a not-so-little secret. The UCLA School of Nursing is the only pediatric APRN program in California that offers a dual specialty option. Yes! Dual, meaning that in 2 years you can do both primary care and acute care together. This is effective both in content and in cost. Additionally, this dual benefit will increase your marketability after you graduate, as you'll be trained to care for children in both the primary care and the acute care context. Along with that dual option, you also have the opportunity to select a single specialty if that's more your flavor, such as doing primary care alone or acute care alone. And we also offer a clinical nurse specialist option as a standalone or in combination with the acute care PNP. So, what will life look like in the UCLA APRN program? We are a rigorous, full-time, in-person program. However, don't be dissuaded by that in-person part. We're in the process of exploring additional hybrid options for our programs, but I can assure you that the high-quality education, fantastic clinical placements at major medical centers, and large clinical groups, that guess what? We will be arranging those clinical placements for you at no extra cost as part of being in the program. And the relationships that you're going to build with faculty in your cohort, they're going to be well worth your decision to choose UCLA. What does the first year look like here with us in the UCLA School of Nursing for the Peds APRN program? Your fall quarter begins with class on campus at UCLA 2 days a week, and those days throughout the course of the program will remain Tuesday and Wednesday. So after that winter quarter, that's going to continue with class on campus for those 2 days per week, and then you'll add on an additional clinical day. Spring quarter of the first year is then going to flip-flop a little bit. You'll have 1 day on campus and then 2 clinical days per week. Summer hours will vary depending on what specialty or specialties that you choose. For example, the dual primary and acute care, you'll end up completing 300 hours during the summer of that first year. That way you complete all of your primary care clinical hours before you transition into the acute care. Many of our students wonder, is it possible to work during this program? And the answer is yes. Most of our students currently work 2 days a week, usually weekends, and many work per diem. I graduated from this program back in 2008, and I worked as a bedside nurse in the ED at Children's Hospital of Los Angeles throughout my course in the program here. It's definitely possible, but requires hard work and a lot of planning. A few final thoughts I'd like to share with you. You may hear rumblings out there about how pediatric APRNs may not be as attractive or marketable on the job market. I can assure you this is not true. There are plenty of jobs out there for pediatric-specific APRNs, both in the hospital and in outpatient settings. Our UCLA PNP and CNS graduates work in clinics and hospitals throughout California. Actually outside of California too, but California specific. We have Children's Hospital of Los Angeles, Children's Hospital of Orange County, Harbor UCLA, UCLA Ronald Reagan Medical Center, Stanford, UCSF, and Rady Children's Hospital, to name a few. So again, if peds is your passion, pursue it. And lastly, as a graduate of this PNP program and now as the program coordinator, I can personally attest to the high quality education and experiences that you'll encounter here with us at UCLA. Thank you so much for taking the time to consider our pediatric APRN program. If you have any questions at all or you just want to connect, please reach out. My email is kwestfall@sonnet.ucla.edu. You can find it on the website, and I look forward to hearing from you. Take care.